This number may significantly reduce in the future should the PrEP drug be rolled out and used effectively. However, emphasis is being put on the need to use other measures in combination with this in order to curb a possible ripple effect of a rise in other STIs. Sharon Momanyi, KTN News, Nairobi.
So Sharon Momanyi taking you through what exactly that drug can do. It's known as pre-exposure prophylaxis, and it will be given to those at high risk of contracting the virus before being made accessible to the rest of the population. That launch happened this morning. Rachel Muigai was there for us. She now joins us live from our City Center studio. Rachel, good afternoon. Tell me a little bit about this drug and how it works.
Thank you so much, Linda. Just earlier this morning, the Ministry of Health, in partnership with NASCOP, launched two specific products that are going to help reduce the HIV prevalence or infection that is being registered in the country. At the moment, yearly, we're registering around 78,000 new cases of infection every year. And it's a very high number given that there are measures that have been put in place, there are strategies that have been put in place, there are campaigns that are being done, but the number is still rising every time. So with this new additional prevention methods, the Ministry of Health is seeking to reduce this number to at least 50,000, which is a bit better. And so these two products include the oral pre-exposure prophylaxis, or we can just call it the PrEP drug, as well as the HIV self-testing kit. So how this oral drug works is that you have to take it for, especially it is for serodiscordant couples, whereby one spouse is infected with HIV, the HIV virus, and the other couple isn't. So for such a specific situation, the one who is at the high risk is the one who is not infected, and therefore they will have to take this pill for at least 6 months for them to be able to be protected from this, from getting infected from the HIV virus. However, for those that are not in that kind of situation, but probably might have multiple sexual partners or engage sexually. There's sexual engagement between men and men. There's also probably the sex workers. For them, taking the pill, the effectiveness of the pill begins at least after 7 days. So just taking the pill for 1 day cannot be able to actually help prevent one from getting infected. And just as Dr. Martin Sirengo of NASCOP, he stated that the drug will cost around 6,000 probably a year. And as he explained to us earlier this morning, the drug a day will cost you only 20 shillings if you are in a position to buy it. And for those that cannot be in that position to purchase the drug at that specific amount, they can be able to get them free of charge at any public health facility or any medical facility at the moment. Linda.
Raquel, listen, you're talking about discordant couples, and you said that probably they have to take the medicine for 6 months in the interest of clarity. So after the 6 months?
This drug, Linda, it's not like the ARVs, because for ARVs, you take them for a longer period of time because it is actually a treatment that you get to live with. But for this specific PrEP drug, it's for a season where you believe that you are at a high risk of getting infected, or because when you're not at a high risk, or you feel like you're not engaging, you're not going to get infected, and that means that you're not engaging in any sexual relations. Therefore, you do not have to take the drug. But for the serodiscordant couples, the note that we were given at that point was that they will be able to just take them for at least 6 months, for them to just protect themselves, because being in such a relationship means that you're engaging more in such in sexual relations. So for serodiscordant couples, it is for 6 months. But one thing we do have to realize is that, Linda, the drug is not a vaccine or a longer treatment. It is just for a season where you feel that engaging in sexual relations at that specific period of time will put you at risk, at a higher risk of getting infected. So that is what the drug is being used for, and it is only for those that are not infected with the virus but are at a high risk of getting infected. Linda.
So basically, before you get this drug, you have to go get tested.